There are many different ways to approach end of life.
As paramedics, we try to treat the patients exactly the way they wish to be treated.
It is not about age, it's about the chapter of your life.
Key thing in geriatrics especially, although it's true in cancer treatment, is not what can we do, but what should we do.
Over the last decade, attitudes and practices regarding end-of-life medical care have changed dramatically. That's partly due to a program begun in Oregon known as POLST, Physician Orders for Life-Sustaining Treatment. In Oregon and now in several other states, seriously ill patients nearing the end of their lives may state simply and clearly what treatments they do or do not want.
POLST form is actually real beneficial for us because it gives us information that the patient may not be able to give us in an emergency situation. So it kind of communicates the patient's desires when they're unable to, or if family members or caregivers are not available.
One of the important things to remember about the POLST form is that it allows people to choose whatever they want, including, I would want to be resuscitated, I would want everything possibly done. And so having a POLST form itself doesn't tell you what the person wants. It tells you that they've thought about what they would like, and you need to look at it closely.
Here's a detailed look at California's POLST form. It's a bright pink page with all the required information on one side of the sheet. That way it is easy to spot and easy to read. The first section pertains to cardiopulmonary resuscitation. This is only used when the patient does not have a pulse and is not breathing. Some people choose the attempt resuscitation option. In reality, however, less than 1% of frail nursing home patients can be successfully resuscitated. So some choose to mark the box, "Do not attempt resuscitation." That's known as a DNR order, or allow natural death. Patients who choose attempt resuscitation must choose full treatment in Section B.
It's hard to talk about do not resuscitate, especially with someone who's still going out and enjoying life with their family. One of the main goals of POLST is to initiate rich conversations between patients and their healthcare providers. In these conversations, people can explore their feelings, values, and goals, as well as get a better understanding of their medical conditions, treatment options, and prognosis. Family members, and especially healthcare decision makers, will gain greatly from the insights they get on their loved one's wishes. As a physician, one of the things I love most about POLST is that this is proactive healthcare, centered around our patients' wishes. The POLST form then transforms these wishes into a set of medical orders which, by law in California, must be honored across the spectrum of healthcare, including emergency medical services, acute care hospitals, and skilled nursing facilities. It empowers our patients with the knowledge that they still have choices to make, and they can choose which medical treatments they want and avoid the interventions they don't want. When they reach this point in their journey, it becomes easier to choose between attempt resuscitation and do not resuscitate and allow a natural death.
Section B talks about medical interventions. The section is only in effect when a person has a pulse and/or is breathing. Some people wish to have every possible medical treatment. Others, with a more serious illness, might want to set limits. For example, they might not want to go into intensive care, but would wish to go to the hospital for less aggressive treatment. Many patients do not want to be intubated or be on a machine to breathe for them, but may consider non-invasive positive airway pressure devices. Some people wish only to be made comfortable, taking no measures to extend their lives. Sometimes patients must be moved because it is not possible to maintain their comfort where they are. Also, patients may have special feelings regarding blood transfusions, dialysis, and other measures which they may write in under additional orders.
Comfort measures are never optional. They must be given. Things like keeping the person warm or clean or giving them pain medication. So there is no way to write a set of orders on the POLST form that will allow those to be optional.
The final healthcare category is artificially administered nutrition. Food and fluids are always offered by mouth if feasible. Some patients would like a feeding tube or total IV nutrition. Recent studies have shown that for patients in an irreversible coma, feeding by tube or vein can lengthen their lives. However, for patients with advanced cancer or Alzheimer's disease, it may not, so they may not want tube feeding. Some patients may want tube feeding for a defined trial, especially when they have a reversible condition and may return to their previous status.
What happens to the nature of human contact? That's the most important thing that should happen in the last stages of life. And tube feedings or artificial nutrition change that nature. And we can do just as well. Some studies have shown that the survival rate is the same with well-done hand feeding. So if they're in the last stages of life, we can do just as well at getting them nutrition, and more importantly, much better at getting them human contact through hand feeding than we would through artificial nutrition.
Section D concludes with signatures of both the physician and the patient or their health care decision maker. These signatures are required for the POLST form to be followed. There's also space for a summary of medical conditions, such as metastatic cancer or advanced heart failure. The backside of the page contains patient information as well as the name and contact information of the healthcare decision maker. If another healthcare professional actually fills out the form, they should note this on the back side, where there are directions for completing, using, reviewing, modifying, or voiding the POLST form.
Here's an example of how a POLST form might work. This patient has advanced cancer, which is spread to his bones, and is enrolled in a home hospice program. His hospice nurse is helping him, with his wife at his side, make the decisions that will determine his end-of-life treatment plan. She explains each section of the POLST form, and after asking questions and conferring with his wife, he makes his decisions. The patient wants comfort measures only, no medical interventions aimed at prolonging his life. When they're finished, the nurse phones in the order to the patient's physician, who will later sign it. Then she signs the form. The POLST is placed on the refrigerator door, in plain sight if it's needed. A few months later, the patient's health begins to decline. His cancer spreads, and he falls in his living room. His wife calls 911, and the paramedics arrive. Seeing that the patient has a valid POLST form, the EMTs concentrate on his comfort. It appears he may have broken his hip, so they transport him to emergency. The injury is not life-threatening, but the patient's pain needs to be brought under control at a healthcare facility. In emergency, the patient's injury is treated and his pain brought under control. When it's time to be discharged, a social worker explains that he'll need short-term care at a nursing facility. She talks with the patient about his POLST form and makes sure his wishes are clear and being followed. The patient's POLST form travels with him from home to hospital to care facility. At each step, nursing staff discuss the form with the patient to make sure his treatment plan's being followed. They make sure the form is in the patient's chart, and when it's time to go back home, the POLST goes with him. Over the past few years, a number of research studies have been conducted on end-of-life medical treatment issues, and results indicate the POLST program is working.
Several studies have been conducted on the POLST program, and all show that the POLST form is highly effective at ensuring treatment preferences are honored. In one of the first studies conducted in Oregon nursing facilities, none of the residents who were enrolled received unwanted CPR, ventilator support, or treatment in an intensive care unit during the course of the study.
The only way a POLST program can really work, though, is if patients, their families, and their healthcare providers talk to one another.
There was a very interesting study that showed that in this large group of 75-year-olds, they asked them, have you thought about what treatments you would want at the end of life? And 76% had. Then they asked them, how many of you have talked to your doctors about your wishes? Only 17%. Then they asked their doctors, have you thought about what treatments you'd give these older people? 67% had. Have you talked to the patient yet? Only 10%. The most common reason given for both groups as to why there was this difference between thinking and talking was because they were waiting for the other one to bring it up.
Since Oregon instituted its POLST program, a number of states have developed their own versions.
Because POLST forms are now being generated in a number of different communities and states, a number of leaders in each of those states, including Oregon, felt that it would be very helpful to have a collaborative effort. And because of that, we formed the National Advisory Panel for POLST and POLST-like programs so that we could really benefit from each other's experience with the form and its implementation.
You can really lift a burden from those you love by completing an advance directive and having the physician fill out and sign a POLST form so that your loved one lives the way they wanted and dies where they wanted, without treatments that they didn't want and receiving the ones they did.
To learn more about POLST in California or to start a coalition in your area, contact Coalition for Compassionate Care of California at www.capolst.org. For more information on the National POLST effort, contact Center for Ethics in Healthcare, Oregon Health and Science University at www.polst.org.